You are welcome to this edition of this series of videos on ear, nose and throat. Somebody has asked a question: what are the potential causes of hearing loss? Well, I'll start by saying that hearing loss, by definition, is decrease in hearing acuity of an individual. When you use the pure tone audiometry to test it, you find that person's loss is in excess of 25 decibel. And this hearing loss can either be one side or both sides. And the hearing loss can be what we call conductive or sensorineural. What are the causes of hearing loss? The causes of hearing loss majorly are infections in the ear will cause hearing loss. Wax in the ear, wax impaction will lead to hearing loss. Exposure to noise in excess of 80 decibel for 8 hours a day in people that use this grinding machine, soldiers that fire weapons, and any person that's exposed to loud noise over time will develop some degrees of hearing loss. Also, people that have foreign bodies embedded in their ears, maybe children or adults, will also have some degrees of hearing loss. Also, in talking of hearing loss, there are other causes of hearing loss, like trauma. When somebody's ear is traumatized, either by a slap or something, or by trauma, head injury from an accident, all these things will damage the drum and also the circular bones and cause hearing loss for that person. Okay, there are other causes that one can meet when you are dealing with hearing. Okay, people that also have a systemic infection, people that have like meningitis, it can damage the inner ear and cause hearing loss, usually sensorineural hearing loss. So those are the things that majorly can cause hearing loss. But there are other factors that predispose people to having hearing loss. Things like if you are immunosuppressed, if you have diabetes, if you are malnourished, and in children, those people have infection and are more predisposed to hearing loss. And also, we should know that some people, there are congenital causes, inherited causes of hearing loss. Some children can be born with problems with the ear and they come down with inability to hear. It's very important that we're going to talk about this later. We'll talk about early examination of children to pick out those children who can hear, who cannot hear at birth. Another potential cause of hearing loss is aging. Just like many other organs in the body, as we age, the hearing cells tend to degenerate. That is what we call presbyacusis. That means hearing loss that comes with aging. By the time you hit 50 years and above, your hearing will deteriorate to some extent. Though not in everybody, but it happens. So when you are getting older, your hearing acuity decreases over time. Thank you.